is Anjali Kulkarni from Medical Students for Choice at it's U of T, right? Yeah.
Hi, everybody. Like she said, my name is Anjali, and I'm speaking from Medical Students for Choice at U of T. So, the Supreme Court of Canada decriminalized abortion way back in 1988. This law, this guaranteed women the right to personal autonomy over important medical decisions, such as abortion, recognizes that a woman's capacity to reproduce is her own choice. This was back in 1988. So in theory, my entire life, every woman in Canada had access to abortion. That would be nice. Unfortunately, that's clearly not the case today. The number of abortion providers in this country are decreasing in part due to inadequate training and exposure to medical school, which I realized in my years so far in medical school at University of Toronto. Through my time with MSFC and with students across the country, I've worked with several of my passionate colleagues lobbying for curriculum change across the country, lobbying the schools to include abortion as part of the mandatory medical school curriculum. And I'm proud to say at U of T we were successful. Over the past year, abortion, scientific and medical aspects of abortion were actually included in the curriculum and not just a discussion about the ethics. Clearly, including these aspects of abortion into the curriculum is one step in training more abortion providers and providing more access to women in Canada. Currently, the province of PEI has no abortion providers. And with the recent closing of the Morgentaler Clinic of New Brunswick, hundreds of maritime women now have to rely on a hospital which places medically unnecessary restrictions on the availability of its services. Aboriginal women, women from low-income households, women living in rural areas of Canada, refugee women. These are among the women who have to travel great distances to access this essential service, thus accumulating huge financial burdens among themselves just to access a simple, safe, legal medical procedure. And that's why I'm standing here fighting for equal access now for all Canadian women. Looking at the turnout we have today, knowing that all of these rallies are going on across the country today in Fredericton, Charlottetown, Vancouver, everywhere else you mentioned, we're sending a message loud and clear to the Harper government that we're here to fight for reproductive justice for all women in Canada. Abortion is a vital component of sexual and reproductive health care for women, and as a future healthcare provider, I'm proud to continue fighting for access for my future patients.